Hey everybody, Dr. Eric Balcavage, and today we're talking about a couple ways that cellular hypothyroidism can lead to chronic leaky gut issue. Leaky gut issues to begin with, but chronic leaky gut issues if there's chronic poor conversion of T4 to T3. So the intestinal lining is about 1 cell layer thick. So the cells are kind of butt together like my hands. Where those hands come together, we call those tight junctions. And those tight junctions have some level of permeability, but not much, okay? And it's tightly controlled. And thyroid hormone plays a role in how tight those junctions are. As the connecting proteins start to break down, those junctions become more permeable. More stuff can leak through here. Bacteria, bacterial toxins, other organisms, improperly digested food. And on the other side of those cells sits a big portion of your immune system. And in time, chronic excessive permeability can trigger immune inflammatory conditions. So let's talk about 3 ways that cellular hypothyroidism could be causing you to have a leaky gut issue. So when there is lower levels of thyroid hormone, we call it hypothyroidism, that can result in low stomach acid production, low bile acid production, poor pancreatic enzyme production, poor release of bile and pancreatic enzymes through the sphincter of Oddi into the GI tract. And that can result in dysbiosis, an imbalance of the normal bacteria in the GI tract. And when we have a dysbiotic situation going on, that can lead to lower levels of short-chain fatty acids. And when you have lower levels of short-chain fatty acids, we start to lose the integrity of these intestinal tight junctions because the short-chain fatty acids help regulate those tight junctions. So that's one way. The second way is that when you have tissue hypothyroidism, you can have decreased release of bile, and bile directly being absorbed through the intestinal cells helps regulate the intestinal tight junctions, okay? So indirectly, by low stomach acid, bile, and pancreatic enzyme production and not allowing that sphincter valve to open appropriately, you can have dysbiosis that leads to low short-chain fatty acids that leads to tight junction leakage. More directly, low thyroid hormone, poor production and release of bile causes poor regulation of the tight junctions because there's less bile acids being absorbed. And then number 3, this is the most direct way, is that thyroid hormone plays a role in tight junction maintenance and repair, helps in the production of those proteins. And so these are 3 big ways that cellular hypothyroidism, poor conversion of T4 to T3 inside cells and tissues, especially within that GI tract, can lead to leaky gut syndrome. So what do? Almost every functional medicine practitioner has got some health nutrient related protocol to help you improve leaky gut conditions. Some people think, well, if I got leaky gut, I got to just stop eating gluten and it'll get better. It may or may not get better. Why? Because gluten may not be the reason directly that you have leaky gut. Could be because of underconversion of T4 to T3. It could be because of low stomach acid, low bile. There's lots of reasons you could potentially have it. So just removing gluten many times doesn't fix a chronic leaky gut issue. If you've taken glutamate, you've taken some other things, and you've continually have leaky gut syndrome going on, somebody's doing an actual test and saying, yes, there's increased permeability here, then what do? My suggestion would be, don't keep doing the same protocols over and over again. Get evaluated for cellular hypothyroidism or tissue hypothyroidism. So you might be saying, but I don't have a thyroid problem. My doctor did my TSH and free T4 and they said I don't have a thyroid problem. He's looking for a glandular underproduction. What I'm talking about is, are you taking that thyroid hormone that's in the blood and moving it into these tissues to actually have the thyroid effect within the tissues? That's really what we want to see happen. So your primary medical doctor, your medical endocrinologist may be just looking for a glandular problem. Even a functional medicine practitioner, some of them may only be looking to see how much thyroid hormone's in the blood. Is the gland bad enough that we need to put it into the blood? But if you haven't heard me say this before, the thyroid gland makes primarily T4. It makes a little bit of T3. Most of the T3 that's made is made by peripheral tissues, bringing T4 in, converting it to T3, that T3 working in those cells for a period of time and going back out into the bloodstream and supporting other tissues. So if we only look at TSH and free T4, we don't get to see how well the body's converting T4 to T3, and we might miss the fact that we have this under conversion of T4 to T3, this lower level of circulating T3, and what we might call cellular or tissue hypothyroidism going on. So definitely get checked. You're probably going to want to see a functional medicine practitioner like myself, who's going to do more than just a TSH and free T4. They probably should do more than a TSH and free T4 and free T3. They should look at TSH. They should look at total T4, total T3, free T4, reverse T3, thyroid antibodies, and they should look at other markers as well, inflammatory markers, and maybe a more comprehensive metabolic panel to look for other indicators that there might be cellular tissue hypothyroidism going on. Number two, check, have somebody, if somebody hasn't done it already, get checked for what we call dysbiosis, an imbalance of the bacteria in the gut. 3, get your levels of short chain fatty acids checked, because dysbiosis can cause a drop in short chain fatty acids. So get checked to see if you have dysbiosis. Get checked to see what your short chain fatty acid content is, because these things regulate the tight junctions of the intestinal tract. And then number 4, get evaluated for what's your stomach acid production look like, bile acid production, pancreatic output, because if you don't have stomach acid, pancreatic enzymes, bile acids and pancreatic enzymes in a sufficient level, then that's going to lead to dysbiosis, lower probably short chain fatty acids, chronic permeability of the tight junctions. But for some of you, you may say, but I had my gallbladder removed, so I don't have a gallbladder, so could that be a problem? Sure, because you're probably not getting appropriate high quality release of bile acids. And so that is potentially going to lead to dysbiosis and potentially lead to intestinal permeability. So if you've been diagnosed with intestinal permeability, leaky gut syndrome, could thyroid be playing a role in that, or thyroid underconversion, whether you have a glandular problem, whether you're on medications or not on medications? Could you still have cellular hypothyroidism going on that's causing you to have a chronic leaky gut issue? The answer is yes. If you need help, go to my profile, schedule a complimentary discovery call. We can talk about what's going on in your situation and whether I'm the person to help you. All right? If you have any questions, put them below wherever you watch this video. Take care.